it's Dr. Rapiti. Welcome to another video. It is Tuesday the 23rd of September 2025, and I want to talk to you about another case of a vaccine injury which I have been treating successfully. And this is a particularly unusual case, but not for me. It's my third patient I'm treating with severe urticaria. For those of you who don't know what urticaria is, it's a persistent itching, and often it's diagnosed as idiopathic urticaria. We normally call it idiopathic when we don't know the cause. What happens is the patient starts itching all over their bodies, and it keeps them out of sleep. It's extremely depressing. It doesn't always respond well to what we call antihistamines. And the patient I'm about to share with you is a gentleman who presented to me with severe itching and severe redness of his extremities, especially the lower part of his legs. He went to see his general practitioner, who diagnosed it as a possible ringworm, which is a possibility. Having failed to get any tangible results, what he did was he decided to get admitted into a hospital. There he was seen by a dermatologist who diagnosed him as having a cellulitis, which is an infection, which explained the redness, and presumably he did have some redness. He was given an antibiotic and given a cream and some steroids. It subsided the infection, but the itching did not abate. The cream did not help him. So he came to see me, and my go-to thing is, first of all, is to ask any patient who presented with an unexplained condition like this, is to check their vaccine history. And from my understanding, he took 2 Pfizer vaccines about 2 years ago, and he had, and I then went ahead and I suspected this might be the side effect of a vaccine. Remember, vaccine side effects don't appear immediately. It's more an autoimmune reaction. In other words, wherever the spike lands, you could have a reaction there. So my suspicion was that it was the spike protein antibody reaction. And to confirm it, I did what's called a spike antibody test, and the normal level should be less than 500. But in his case, it turned out to be 16,000. I also did a D dimer because I think when one is treating a vaccine injury, one should look for clotting problems, because you could, unfortunately for him, that was not a problem. So I made a tentative diagnosis of idiopathic urticaria secondary to COVID side effect on that basis, and I also suspected a condition called MCAS, which is mast cell activating syndrome. We then I gave him a depot steroid injection. We put him on a high dose of an antihistamine, like it was acetamide. It was Alocet, which is cetrazine, and I put more than the usual dose of 10 milligrams twice a day. And I put him on ivermectin, and I'm also adding Natokinase. The Natokinase will dissolve the spike protein, and the ivermectin works very well for rosacea and also for the spike protein. I'm pleased to say this has taken place from November last year, and I've been treating him now for just over a month now. And in this period, he's made a tremendous recovery. His rosacea is settling. Ivermectin is extremely good for rosacea, but it's also good for the spike protein. In spikopathy treatment, I would highly recommend it. But yet to tell us a little bit of his experience as a gentleman himself. So you'll tell us briefly what happened to you in November.
November, I was basically going to a doctor for a ringworm at the back of my leg, which the doctor tried to treat, but then it spread, and then it got worse.
In hospital, you landed in hospital?
And then I landed in hospital.
And what treatment were you given there?
They were giving me treatment there for, as you mentioned, cellulitis.
Did they mention anything about it might be a spike injury?
And they never mentioned anything like that.
So you were discharged on creams?
That's correct, yes. To
And
them
how
it
did
was,
you feel after taking those creams?
there wasn't much difference in the leg cleared up in a certain sense, but the redness did not go away.
The itching?
The itching was actually becoming worse, hence
Yeah.
the fact that I went to go and see a dermatologist
Dermatologist, yeah.
to get
Opinion.
an opinion and then also maybe
What
get some
did she
treatment.
say to you?
She again also had something that she mentioned about also dermatitis,
Yeah,
cellulitis, dermatitis,
okay. And
and
did her treatment help you?
not at all. The creams I normally use just for sort of moisturize, but it didn't clear up any itching.
Right,
Hence the
now
fact
that
that I
you're on
came to
treatment
you.
after a month now, how are you feeling?
My itching is subsided a lot. I get to
What's the
sleep
quality of your life?
much better. I sleep much better. I
How did you
do.
feel when you were getting this itching? How did it affect you?
Well, it affected me psychologically because I couldn't sleep. I wake up at night 3, 4 times, itching a lot. I also at the same time it sort of disturbs my wife as well, you know. And yeah, the itching was quite bad.
Okay. We just want to show you quickly some of the rosacea. You can have a look at it on your skin. It was there it is. Okay. Well, there you have it. It was quite bad, and I think one should be suspicious when you get a condition that you cannot explain. Always look for vaccine history and treat for spikopathy. And in this particular case, we've achieved some success. And I can say this with some confidence because I've treated now 3 patients with similar presentations, and I don't think we realize how severe this condition is. It's extremely debilitating. It affects a person's quality of life. In his case, it affected him psychologically, but in my previous patient, a 72-year-old female, she was rendered almost suicidal. Fortunately, she settled and she's good on treatment. What I can just make you be cautious of is that we don't know how long the spike remains. It could flare because the spike, remember, when it enters the cells tend to multiply and you could get a relapse of the condition. Hopefully this gentleman won't have it. Well, I hope those of you who have a similar condition can take this to your doctors and try and get some treatment, because urticaria that is not treated or not responding to treatment is an extremely distressing condition and should be addressed, and I would consider it as a serious vaccine injury. I hope you have learned from this. Thank you and have a great day, Dr. Rapiti.